This video is a quick introduction to the proper positioning for a clavicle radiograph, AP and AP axial views. In order to successfully accomplish this examination, you're going to start off utilizing a 10 by 12 image receptor placed within the wall bucky in landscape view. The wall bucky should be placed 40 inches from the X-ray tube in order to successfully achieve a 40-inch source to image distance. Let's go ahead and have our instructors demonstrate how we will perform this examination, beginning with the AP view of the clavicle. As you can see, the patient is starting erect with the back against the wall bucky. The patient's arms should be at their side and have him or her raise their chin and looking straight ahead. The posterior shoulder should be in contact with the image receptor without any rotation of the body. The center ray should be perpendicular to the mid-clavicle, and the image receptor should be centered and aligned to the mid-clavicle as well. There should be no angulation in the tube, and a marker should have been placed lateral and in the top part of the image receptor within the light field. In order to obtain the image, you're going to instruct the patient to remain still and suspend respiration at the end of inhalation. This will help to elevate the clavicles. After the exposure has been made, you may tell the patient to relax and breathe normally, enter the room, and remove the image receptor from the wall bucky and process it in order to acquire the radiographic image. We are now ready for the AP axial view. Side note, please make sure to place a lead shield between the patient and the radiation source in order to protect the patient from the X-rays. For the AP axial view, we're going to utilize a 10 by 12 image receptor within the wall bucky in a landscape view, and the wall bucky will remain 40 inches source to image distance. Nothing will change in regards on how the patient is standing or located. The only movements should be utilized by the X-ray tube and the wall bucky. Notice that our instructor angled our X-ray tube anywhere between 15 to 30 degrees cephalic and pointed to the mid-clavicle area. In doing so, it places the center ray above the wall bucky as the wall bucky stood before. Therefore, our instructor had to raise the wall bucky to match the center of the image receptor to the center of the center ray. The marker should have remained in the same place in the lateral and top part of the image receptor. Again, you're going to instruct the patient to remain still and suspend respiration at the end of inhalation in order to help elevate the clavicles. After the exposure has been made, you may enter the room, remove the image receptor from the wall bucky, and run it through the processor in order to acquire your radiographic image. Again, the lead shield should have been placed between the patient and the radiation source to protect the patient. But this concludes a clavicle AP and AP axial view. Now let's go ahead and see what these images should have looked like once they were processed. Here we have an AP clavicle. You should see a full body of the clavicle from one joint to the next, from the sternoclavicular joint in the far left to the acromioclavicular joint in the far right. You should also be able to see the acromion process on the far right and some ribs in the very top portion. The proximal humeral head should also be seen, but it's not a necessity. However, it will show up. Now, because we're going to go ahead and angle the tube to that 15 degrees for the axial view, the main difference will be how the clavicle is projected on the image receptor. Let's go ahead and see how that changes. There we go. As you can see, now we're seeing a different portion of the clavicle as the X-ray tube was angled Still, we're able to see the sternoclavicular joint as well as the acromioclavicular joint. And the humeral head, the proximal humeral head, is also displayed on the far right of the image receptor. The full spectrum of the clavicle should be appreciated. When we took the x-ray, we wanted to make sure that we collimated as close as possible to the clavicle so as to refrain from having scatter radiation and limit the amount of quantum model that is produced by this examination. This concludes the quick introduction to proper positioning for a clavicle, AP, and AP axial views.